Wonderful. You have the floor.
Awesome. Well, I'll want screen sharing when you can give it to me. There we go. Cool. So I'll just give my standard presentation, and then actually you can tell me a little bit more about your org, just because I've presented to a lot of different orgs, but I feel that this might be kind of a unique one in terms of, I don't know that I've presented to one quite like this before. So let me just start by saying, I'm here presenting on behalf of Whole Washington, and I always like to start by introducing the organization. So Whole Washington is a nonprofit 501c4. We were founded in 2017. We're 100% volunteer run. So that, goes right up and down from everyone to me, the campaign director, to everyone out there gathering signatures. We don't have any paid canvassers or anything like that at the moment. And if you want more information about us, we've got a website, wholewashington.org, and you can see everything from our meetings to signature gathering events on the events page. If you want to get involved, you can go to the volunteer page. Campaigns like this take money, so you can send donations our way. And then I'll try to answer as many questions as I can today, but really most of the questions that come up are answered very well on our FAQ page. So those are just a few resources to check out. And our slogan is healthcare that's always there. And I hope that we have a shared understanding of what that means by the end of this presentation. But to just take a sec on the who, Whole Washington, the who, I'm the campaign director. My name's Andre. That's my email address and phone number at the top there. So I always encourage people to get in touch. Georgia is our operations director. She also founded Whole Washington, and I blame her for getting me in this mess, because you hang around her too much and you might find yourself the campaign director of a statewide ballot initiative. I was actually in tech before this. I left my job at Microsoft to focus on this campaign. Seemed a lot more important than working on the Bing email platform. And Jen is our communications director / volunteer coordinator. So if you get involved, you'll probably hear from Jen real soon, and she's an absolute delight to work with. And then our board, which really has people from all walks of life. So we have people like Jason Call, who's currently running for Congress, federal Congress. We have the retired Senator Marilyn Chase, disability advocates like Naomi Finkelstein, and then people from the nursing practitioner like Mariana and Catherine. So really just a great variety of people on our board, and this organization is in great hands. But the heart and soul of it really is the volunteers. So to do what we're trying to do and get this on the ballot, it's really not possible. We wouldn't be talking about this unless hundreds and hundreds of people shared this dream with us. And so I always say that we're trying to create a universal campaign for universal healthcare. So anyone can be involved, and we're not going to just ask you to sit in meetings or beg legislators to give you the time of day. We really give people very direct ways to contribute to the campaign. We're always looking to grow our coalition. So you can see here that we organize down to the LD level, and we've got a bunch of them. So you can see on that map there, those red ones are the ones that have passed resolutions of endorsement. And, we'd love any help we can get turning this entire map red. But we've also gotten the support of an entire city council, the Aberdeen City Council. We've gotten county Democrat organizations, Kitsap, Jefferson, Snohomish, and then just fantastic grassroots orgs like Washington Adapt, Sunrise, the Washington State Federation of Democratic Women. And I personally am quite proud this year. We got the Tenants Union of Washington and the Transit Riders Union. They're two unions, and they are they do very great work on homeless issues, poverty issues, and those are really the communities that are most impacted by our terrible healthcare system. And so it's really important that they're a part of this. And a little bit of a scoop, these are some of our most recent endorsements. So we just recently got the Washington Physicians for Social Responsibility, King County Democrats, and then my home LD, First District Democrats. So I've lived in Seattle since I went to college, but getting back out into the suburbs, I was really pleased to present to them and get their endorsement. But just earlier this week, we got Thurston County Democrats. So we're really starting to get some broad support across the state here. And this is the sort of thing that we like to do for folks who have endorsed us. So featured whole Washington endorsement. This was something we threw together for LD 48. And the point here is just that, you know, when people endorse us, we really like to think of it as a partnership and not just a logo that we put on our website. We want your input. We want your feedback. We want to involve you. And we also want to hear about what you're doing and seeing if there are ways to synergize that. So, you know, just little ways in which that we can really make everyone feel a part of this. So getting a little bit more into the policy, you know, what do we mean by universal health care? And, you know, we're actually not talking exactly about universal health care. We're talking about universal public health insurance, which is often called single payer health care, sort of a textbook definition. So the thing to understand here is your doctor is not going to be an employee of the government. Your hospital is not going to be government run. We're just talking about the financing part of this, right? So publicly financed healthcare, but you would still see a private practitioner in most cases. Personally, I get a lot of my care through the UW medical system, which is a public hospital, but most practitioners will remain private practitioners. And so our public health insurance plan would be called the Washington Health Trust, right? So we'd all be covered by the Washington Health Trust. And that's the first principle of what we mean, right? So principle number one covers everyone. And when we say everyone, we're talking about Washington residents. And we use the state definition of residency, which is 30 days. And that means that you're going to be covered regardless of your situation, right? And that could be your marriage situation or your housing situation or your employment situation or your citizenship situation. And most importantly, no matter how those situations change, you're going to maintain that coverage, right? So you get laid off, you get a divorce, you get evicted, you still have the healthcare because it comes from the state of Washington, not your employer. So number two covers everything. And the point here is that you shouldn't need to have additional out-of-pocket spending. You shouldn't need to buy additional supplemental private health insurance. We're talking dental, hearing, vision, mental health, reproductive health, prescription drugs, and much, much more. Really more than we can list on this slide. But if it's a medical need, it's covered. And that's the way that we think it ought to work. And then number three, publicly funded and free to use. So, you know, we don't want to see massive profits made off of people's sickness. So no shareholders, no CEO bonuses, no stock buybacks. We want this to be nonprofit. We want it to be transparent and done through public financing. And free at point of use, what we mean by that is it's not that doctors are going to work for free and prescription drugs aren't going to cost any money. But what it does mean is you're not charged for your care, right? So when you go to the doctor and you get your care, it's already paid for. Sort of like when you use the services of, say, the library or the fire department. Everyone knows books cost money, but you're not charged because it's already paid for. And that gets into the question. So if we're not being paid, if we're not being charged for using the services, then how do we pay for it? And I always like to flip that around. How are we not going to pay for it? Right? So we're not going to be paying deductibles, premiums, copays, medical bills, out-of-network charges, and high prescription drug costs. In fact, the only out-of-pocket expense that anyone can expect to pay under this system is $250 a year for prescription drugs. That's a maximum. And I didn't even realize how good this deal was until recently, because really generics are covered And if there is not a generic available on the market, that is also covered. The only time you pay that copay is if you choose to use a name brand drug instead of a generic. And the reason this copay is in there is to encourage the development and use of generics. So where does the money come from? And one thing that's not on this slide actually is that a significant portion comes from federal money. And we can get a little bit more into that in a second. But in terms of local taxation, there's a 10.5% employer tax. And then there's an 8.5% capital gains tax. And the thing to understand about the capital gains tax is that the first 15,000 are totally exempt. And then also home sales and retirement accounts are exempt. So this is really intended to target high wealth individuals, high income earners, and 90% of Washington state makes less than 10,000 a year in capital gains. There's a 2% tax on sole proprietors. Again, first 15,000 exempt. And then employee payroll, 0 to 2%. Why 0 to 2%? Well, the thing that's a little bit tricky to understand about this, actually, is this on the next slide? Yeah, okay. So really what it is that the employer is on for 10.5. They can take up to 2% of that from employee payroll. So the employer might pay as little as 8.5%, and the maximum that you would pay as an employee is 2%. And the employer can choose to cover that as an employment benefit. Keep in mind, this is in place of your private premiums. So you don't have to pay your private healthcare premiums anymore once you're covered by this. And what are the benefits? I think a lot of them have already been made pretty obvious, but the first is that it saves a lot of money. It costs between 5 and 13 billion less annually in terms of total healthcare spending. And 95% of Washington will be paying less and have more money in their pocket at the end of the year. And then more stability. So we have very unstable healthcare. Everyone in this country, even if you have good healthcare, it can very easily change. And we saw tons of people get kicked off their private health insurance during the pandemic. So now you would have stability. You don't need to switch your insurance when your situation changes. More simple, so no bills, no paperwork, no COBRA, no more being held on hold by your private insurance company. And then last, more fair. So this makes the tax code more progressive, and it doesn't put people in debt for needing healthcare. And the number one cause of debt and bankruptcy, the number one cause of bankruptcy in Washington and the country is medical bankruptcy. This would end that in Washington state. But really, when I think of what the benefit is, I think of this quote: of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. That's Dr. Martin Luther King. And it really puts it into perspective for me, because when I think of 500,000 people in Washington with no health insurance, or 45,000 people a year who die because they can't afford healthcare, and then I think about what those people look like, we know that when there's an inequality like this in the United States, that those people look like the most vulnerable members of our society. So we're not just talking about cheaper healthcare or more convenient healthcare. We're talking about a more just healthcare system and a more just society. And how are we going to pass it? Whole Washington is best known for our ballot initiatives, but folks should know that we always introduce this in the legislature. We would love for the legislature to pass this. It would save us a lot of time. So it's been introduced in the Senate by Senator Bob Hasagawa. It has 7 co-sponsors. It also has 9 endorsements in the House, although it has never actually been introduced in the House. And it's unfortunately been stuck in committee every year that we've tried to get it through. It's never been given a vote or a public hearing. And so that is why we are so fortunate to live in Washington state, where we can take this directly to the people and directly to the ballot. So we filed Initiative 1471, and that gives us until December to collect signatures, and it would go on next year's ballot. And our goal is 400,000 signatures. That includes a pretty significant margin of error for invalid signatures. So we really need more like 320 or 325,000. But 400,000 is a nice round number that's easy to remember, and it accounts for those invalid signatures. And then the transition plan, this slide tends to be a little bit more for the really wonkish, but basically the way this works is we're going to collect the signatures. It goes on next year's ballot. We win the election. So the Washington Health Trust becomes law, and on day one, all Washington residents are eligible for enrollment. Now, there are some people that we can't initially incorporate into the system. So there are people who are covered by plans protected by a federal law called ERISA, and that means that you really can't touch their healthcare plan. So we can't just take them from their plan and move them into ours. The other is Medicare. So people on Medicare, we can't just move them into our system. We can't just move that federal money into our system without acquiring federal waivers. So part of our transition is to acquire those federal waivers. And then when we achieve 51% coverage of people in Washington by public healthcare plans, we then transition the ACA exchanges into the Washington Health Trust. So to put that into a bit of context, about 40% of Washington is already covered by state healthcare plans. So we're not talking about going from 0 to 51%. We're talking about going from 40 to 51%. But at that point, we actually shut down the exchanges and we get Washington State out of the business of selling private health insurance, is the way that I would say it. And that doesn't mean that there would be no more private health insurance. It's just we don't maintain the exchanges to sell it. And so now, once we get through that transition, all Washington residents would be covered by the Washington Health Trust, except the Veteran Affairs and the Indian Health Services, which have very specialized needs and very specialized regulations. And just like the federal Medicare for All bill, we just leave those separate. So I always like to end by emphasizing that Washington State can do this. We've done this before on a number of issues. So whether we're talking about marriage equality or drug decriminalization, or more salient than ever, right to an abortion, which was legal in Washington well before Roe versus Wade and remains legal today. Washington can lead on this issue through its example. And there's two stories that I like to tell to really bring this home. So on the left, we have Canada, and that red province there is Saskatchewan, because that was the first province in Canada to pass Medicare, which was the beginning of their healthcare revolution. And today, Canada has one of the finest healthcare systems in the world. On the right, we have the United States, and the red state there is Massachusetts, because of the last federal reform for healthcare was the Affordable Care Act, also known as Obamacare, and as it was known before Obamacare, Romneycare. And the point is that it came from the state of Massachusetts, and that the states have great influence over federal policy. And when there's a moment of federal reform, we know that we're much more likely to get something that is on the table because it's been put on the table by a state. And so Washington wants to put a better healthcare system on the table. And just to show you the power of the ballot initiative, we have here 6 states. And other than Maine, which is a liberal state, the rest of them, they are not rural, they are not urban states, and they are not liberal states. They are rural and conservative states. In fact, just like Saskatchewan was a rural and conservative state. And these are all states that expanded Medicaid, not through their legislature, but through the ballot. And in fact, did it against the wishes of their governor. So there are many roadblocks for universal health care, but there are ways around them. And the ballot is a very powerful way of expanding it. And just to add a little personal note to this, Washington is also a Medicaid expansion state. And I myself am on Medicaid. And the fact that I have my healthcare covered by Medicaid is the only reason I can do something like leave my job at Microsoft and focus all of my energy on finishing this movement for healthcare justice. It means that I get to do that without being left completely uncovered and vulnerable. So as limited as Medicaid expansion has been, it still has gotten many, many people healthcare. And the more people who we free from private health insurance, the more people we can get into this fight, and the more likely we are to win. So let's talk about action. wholewashington.org/volunteer if you want to get involved. You'll hear from us real soon. This is a very easy form to fill out. So before I'm even done with this presentation, you could already have signed up. It's just a few little bits of information. It's not a commitment. It just means you'll be hearing from us, and we'll be trying to see if you want to get plugged into the campaign and how. But if you just want to sign, or you're really a self-starter and you want to collect signatures, you can go to wholewashington.org/sign. And what you'll find there is we have a map. And on that map is our bin hosts. And what you'll find at all of these locations is a bin. And depending on which one, you'll see some of them are businesses, some of them are residents, but you ought to be able to pick up a signature sheet. You can ask your friends and family to sign it, and you can sign yourself. So you don't even need to ever get in touch with us. You can just swing by and sign if that's what you want to do. And maybe you can't gather signatures. Maybe you're mobility impaired or something like that, but you can still host a bin and play a very important role in the campaign. And last but not least, we always want to grow that coalition, as I said, and we would love the endorsement of your organization. So you can go to wholewashington.org/endorse wholewashington, and that will let us know that you're ready to endorse, and you can be featured on our website and get added to our group chats and all of that, and get involved with the campaign however makes sense for your org. So thank you so much for the time and listening to my presentation, and I'm always happy to answer any questions.